Our organization started in 2003, and it was originally called the Colorado Asian Pacific Islander TB Elimination Program. It was started by a partnership with ours and the state of Colorado because they were seeing a very large increase in the TB rate for the state. And so Asian Pacific Islanders were the highest risk. And so as a result, a group of community leaders were assembled and we created a partnership at that point. Subsequently, in 2008, the name was changed to Colorado Alliance for Health Equity in Practice because we were working with immigrants and refugees that were not only Asian Pacific Islanders, but there were others that certainly came in our jurisdiction. Uh, our focus has always been to help the underserved in a culturally and linguistically competent manner. While the majority of our clients have been Asian Pacific Islander, being the Chinese, the Korean, the Vietnamese, the Asian Indians, and they have also been the Burmese, the Nepali, uh, and then people from Afghanistan more recently. So really, in terms of the total number of communities and ethnic groups that we've been serving, have been approximately 15. We still keep our doors open to anybody who is underserved and anybody who is having cultural and linguistic barriers.
And the goals would be to increase patient acceptance in testing for and treatment. We're trying to increase the numbers of individuals in the target population who are willing to be screened, tested, and if need be, treated for latent TB infection. And the biggest goal is to remove the barriers that are inherently in the community towards TB in general, so that they want to hear and want to try and clear it up if need be. Outcome is to incorporate testing as a normal standard of care for everybody. This is our second year in this project. The first year we were partnered with Colorado Department for Public Health and along with the Denver TB Clinic at Denver Health and obviously Colorado Department of Health. Denver TB Clinic specializes in TB. Specifically, they are at our Denver Health Hospital. And this second year of our grant, we are partnered with the Denver TB Clinic solely, though CDPHE is there to support us if need be.
Back in 2003 and 4, there had been a sort of an uncontrolled increase in TB rates. And they were primarily in the Asian Pacific Islander community in Colorado because it was not an organized method to communicate with the APIs. So the language and cultural barriers became a significant matter. So they worked with us. They did talk to us and said, well, what can we do? So we brought in some community leaders. And that was the genesis. That was the start of the partnership. And since that time, we have worked together. Things have been quite positive. And also there has been a significant amount of screening and education and outreach in many different languages. So effectively, the partnership has existed for about 17 or 18 years. Well, the mini grant establishes a system of care for a very important and significant health concern, which is TB or tuberculosis. It helps us create a baseline and a method that would be important not just now, but for many years in the future. While we have a successful community primary care clinic, I think often our providers and our stakeholders and our patient navigators, they did not have a formal methodology in place to do this in a systematic manner. So this mini grant helps us create that infrastructure and knowledge and awareness, both within our organization, within our clinic, but also to help us propagate out into the different community centers, their churches, the temple, the synagogues, and that's why this is a very important grant for us.